In today's Daily Health, it is National Infertility Awareness Week, and today we're focusing on some of the causes of infertility and how to support those affected. According to the World Health Organization, infertility affects about 1 in 6 people globally, and it impacts people of all ages, genders, races, and lifestyles. Joining us now is Dr. Lucky Seacon. She's a board-certified reproductive endocrinologist and infertility specialist and an OBGYN. She's also the author of the forthcoming book, The Lucky Egg, Understanding Your Fertility and How to Get Pregnant Now. Thank you so much for being with us.
Thank you for having me.
So the data is striking because it shows that a lot of people now are trying to conceive later in life.
Yes.
Unfortunately, biologically, later is anything older than 30, right? Can you walk us through the other risk factors for infertility?
Yeah, so age is definitely a huge component on the female side because of our biological clock, right? We're born with all the eggs that we're ever going to have. And over time, the quantity and the quality both decline. And that can make it harder to get pregnant and to stay pregnant. There are also other factors on the female side, like problems with the reproductive tract, fibroids that can block the passage from, the embryo getting from the fallopian tube into the uterine cavity. On the male side, which makes up 40% of cases of infertility, you can have problems with sperm production or the sperm not being able to swim to the egg. And then 20% of cases are unexplained, which is a major source of frustration for so many, because while we have standard tools and tests, they're not always going to be able to uncover key causes of infertility like egg quality issues. There is no direct way to test that.
And I appreciate that you walk through both common causes, risk factors for women, but also for men.
Yes.
I think a lot of people might be shy to share with their doctor, I'm struggling to conceive. I'm trying to do this and it's working. It's not working. What do you say? How long should you be waiting before you go to your doctor?
The first thing I tell people is they are not alone. As you said, 1 in 6 people are affected. So it's just that people aren't shouting it from the rooftops, right? And they're keeping this to themselves. It can be very isolating. But it's important for people to be aware that human reproduction, while it's inefficient and it's not a cause for concern if it doesn't happen the first time you try, it's important to know that after a certain amount of time, you want to look for potential barriers and potentially look into treatment. And if you're under 35, that means not waiting longer than a year. If you're over 35, not waiting longer than 6 months. And if you're in your 40s, you want to be proactive and see a doctor after 3 months of trying.
And what are some of the options for someone managing infertility?
It's all about trying to rectify the inefficiency of human reproduction. So there are really 2 buckets of treatment. There are things like medicated IUI, so boosting ovulation, potentially ovulating more than 1 egg, which can feel like a long shot, and getting a higher concentration of sperm delivered closer to the eggs, right? That is a more laid-back treatment approach compared to IVF, which is much more direct. It's taking the shots, the 8 to 10 days of stimulating the ovaries, having your eggs extracted in a procedure called an egg retrieval. Us growing the eggs into embryos outside of your body, we can test the embryos, which has really dramatically improved the success of IVF. And we can put back 1 embryo at a time with as high as 70% rates of pregnancy per embryo transferred. So nowadays we can tell patients within 3 transfer attempts, over 95% chance of pregnancy.
And that's so much to walk with, to hold as a person, as a couple.
Yes.
Any tips of things to say or not say to someone in your life who might be walking through this?
Well, you never know who's struggling because people often struggle silently. So I err on the side of not asking too many questions. Let people volunteer what they want to about their journey and why they have children or don't have children. And I think it's important to also, if you know your friends are going through this, to check in on them. Don't disappear, because sometimes it's hard to know what to say, but just saying something and showing up, it's the small gestures that can go a long way.
And just briefly, I wanted to talk about the title of your new book, The Lucky Egg. And you say, for people who want to get pregnant now, what's your takeaway for folks who want to do that?
Well, whether you have infertility or you're just trying to get pregnant on your own, it's not something that's going to immediately happen, but it's important to know that you want to be proactive and efficient.
Dr. Lucky, thanks.
Thank you.